different way. We are going to do a recorded lecture so that you may access the content in whatever way is meaningful to you. Some people would like to see it again. Some people would like to start and stop so they can take notes. Whatever suits you is fine. We'll see how it goes. So Unit 13, Anatomy, 252 is the page. Starts with the heart. We're going to do 13 and 14 together because it doesn't make a whole lot of sense about talking about the heart without talking about the circulation as well. So we're going to talk about the structure and function of the heart. We're going to talk about how it is integral to the entire circulatory system. We're going to talk about the heart as a muscle and some of the special properties of those muscles, things that can go wrong, and diseases of the heart. So first thing you know, the heart is in the thoracic cavity. It is about midline between the lungs, and it's surrounded by a fibrous sac called the pericardium. There's an excellent diagram on 253 that kind of walks you through the placement and how it relates to the lung and the great vessels. So the heart is the pump that circulates blood to all areas of the body. That's its main job. We have blood vessels called arteries and veins and capillaries that take the blood from the heart and bring it back. We know that blood carries oxygen on the red blood cell, also carries nutrients to the cells so they can complete their function, and also brings back waste products so that they can be eliminated. And we already talked about lymph as an accessory to the circulation. So any extra fluid that's floating around between the tissues and between the cells is returned to the central circulation by the lymph system so it can be reintegrated into the circulation or eliminated maybe through the kidneys. So if you look at this diagram, it kind of shows you that blood travels from the heart by way of arteries. Those are outlined in red here. And then it returns back to the heart from the tissues by way of veins, which are denoted in blue here. We have different circulatory systems within our body. We have one great big one. Then we have little closed circuits, so like cardiopulmonary circulation. The circulation of blood from the heart through the lungs back into the heart and out to the body is one type of circulation. We also have a special circulatory system in the abdomen, supplies all the bowel and stomach. And then there's maternal fetal circulation, which is a unique kind we'll talk about in the next unit, the way that the blood circulates between mom and baby. So the blood changes in its travels. So when it leaves the heart, it should be fully nourished, it should be fully oxygenated and ready to supplement the tissues so they can do their functions. When it gets to the tissue, that's where that exchange will take place. So you'll see when it gets down to the little tiny capillary levels, the oxygen will go out, the carbon dioxide will come in, the nutrients will go out, the waste will come in, and as the blood turns around and comes through the veins to come back to the heart, it's a different composition than when it left, if that makes sense. So the heart's about 5 inches. It's about 3.5 inches wide. If you put your hand into a fist, that's the size of the average heart. It weighs about 1 pound. It is midline and sits off to the left a little bit. It is behind your breastbone, your sternum. It is not to the left side of your chest like people think. The reason people think that your heart's on your left side is because this area right here, the apex of the heart, does lie off to the left a little bit, and that's why you hear the heartbeat so much louder on the left. And then it's protected on all sides by its pericardium, which is its fibrous sac. And then beneath it lies the diaphragm, and that separates the thoracic and the abdominal cavities. So we've talked about this before, that without blood flow and i.e. oxygen, you have 4 to 5 minutes before you start having tissue damage, especially to the brain and to the heart. So after that time, you can have irreversible damage to heart tissue and brain tissue. We listen to the heartbeat through a mechanism called the stethoscope. We will work on that. We'll introduce that, how to use one soon. When the heart stops and someone needs to be resuscitated, that is called cardiac arrest. That is biological death. And CPR is the skill that you learn to bring somebody back from biological death. And we'll do that stuff in the future. So the heart is a muscle, period. It's hollow. It's a double pump. It is surrounded by a pericardium, which is its protective tissue. And then the muscle's divided into 3 types of muscle. epicardium, which is the outermost layer, myocardium, which is the middle layer, it's the strongest layer, and endocardium, which is the smooth muscle lining of the inside of the cardiac muscle. So this mostly is not important. When it becomes important is when you have problems. So for example, when you have tissue damage from lack of oxygen, oftentimes if someone's experiencing a heart attack, it's this myocardium, the strong part of the muscle, that's not getting oxygen. If you have someone who is getting a bloodstream infection and has heart complications because there's bacteria circulating in their blood, oftentimes that's the endocardium because that's the lining part of the heart. And that can become infected from the blood that's going through the heart. So again, for the day-to-day, this is not important. Sometimes when the pericardium becomes inflamed, it will make extra fluid and the patient will have chest pain from a condition called pericarditis. So 90% of the time, you don't even know you have a pericardium or a pericardial cavity, but that 1% of the time, you may realize you have one because it hurts. The great vessels, or the big blood vessels in the chest that carry the blood to and from the heart. The big vessels that bring the blood back from the body are the vena cava. So there's a superior, which means on top, and an inferior, which means on the bottom. If you look at 254 and 255, there's some pretty good pictures. You also have the aorta, which is the big blood vessel that carries the oxygenated blood and branches out so it can be delivered to the tissues. From the aorta, you have what we call the coronary sinus. I don't know if there's a decent picture in your book, but what the coronary sinus is, it's a little tiny opening at the aorta right when the blood leaves the heart chamber and goes into the blood vessel. And that opening allows oxygenated blood to circulate to the tissue on the heart. So if you look at, 254, or maybe on the next page, here we go. So if you look at this diagram, and you see right here these little red arteries, these are the ones that actually feed the heart. Because remember, the heart pumps blood, but it needs blood too. So the coronary sinus is a little opening here on the aorta that allows the oxygenated blood to perfuse the heart. And then obviously the veins do the same thing. They dump the deoxygenated blood back into the circulation. The other thing on the great vessels is you have pulmonary arteries and pulmonary veins. These are the arteries and the veins that take the blood from the heart to the lungs to become oxygenated and then bring it back to the heart to pump it out to the rest of the body. So those are depicted, where's my mouse? Here. There's the right pulmonary veins, left pulmonary veins, pulmonary artery, pulmonary artery. What's interesting about the pulmonary circulation is it is what you would say opposite of the rest, meaning I'm making a recording. I'm making a recording. Make it stop. I don't know how to make it stop. Stop.